You're listening to the Smart Policy Podcast, a production of the University of Tennessee's Institute for Public Service. As we've discussed many times on this show, the criminal justice system has long since become the primary point of contact for substance use disorder, especially in Tennessee.
Jails have become your mental health facilities, and how do we manage it? How do we help individuals that come into contact with the justice system?
My guest this month is Eric Bowder, Deputy Chief of Corrections for the Davidson County Sheriff's Office. While participating in an overdose fatality review team, he learned key details about how people were overdosing shortly after leaving the county jail, even those that had engaged with the jail's successful behavioral care center.
This can't be happening. We've got to do something. I've got to do something.
In the last year, Eric led the charge in implementing two critical evidence-based solutions: Naloxone vending machines and initiating medication-assisted treatment during incarceration. These new programs stacked onto the jail's already robust mental health and education-focused programming, and the impact is tangible.
I don't know where across the country you have individuals that, come back to jail and say, hey, thank you for what you've done. But we have countless individuals who come to our lobby at the Behavioral Care Center to say thank you.
In this conversation, we dive into the challenges he faced in obtaining the vending machines.
We are the only county jail in the state of Tennessee that has these machines.
The barriers involved with launching MAT in jail, and more importantly, continuing it afterwards.
One of the barriers that we have continuing the care is the price of it when they get out. The longest you're going to be in our local jail is 11 months, 29 days. So, you only have, so much time. And then at the Behavioral Care Center, the max stay at the Behavioral Care Center is 30 days. So we can get you started on that, but it would be up to the individual when they get out to find funding, I guess, to continue that care. So that's definitely a barrier.
And we finish off with an exploration into what makes the Davidson County Jail's Behavioral Care Center so impactful, especially on recidivism rates.
I'll tell you this, there's no blueprint and there's no book written for what we did. My name is Eric Bowder, and I work for the Davidson County Sheriff's Office here in Nashville, Tennessee. I've been with the agency for 31 years. I was the administrator over the Behavioral Care Center, which is a diversion program that we have here in jail that identifies individuals who might have mental health disorders or substance use disorders upon arrest, and we divert them to the Behavioral Care Center. Since then, I've been promoted to Deputy Chief of Corrections, and it would include overseeing the Behavioral Care Center, but it would also include all programming for the Davidson County Sheriff's Office within the jails. So those are the kind of things that I'm doing now. So it keeps me busy here at the Sheriff's Office, not only overseeing what is happening at the Behavioral Care Center, but the programming that's happening throughout the facilities as well. So it's exciting. I've been doing that since February, and I like what I'm doing now, and it's being able to touch even more people that are incarcerated and try to give them some hope while they're incarcerated, and programming so that we can, while they're here, we have an active audience, and we want to try to offer them as much as we can so that they don't come back to jail.
Right.
But what I wanted to talk to you about today was, how did this, I obviously have an opioid epidemic across the country, and Nashville is no different. Around October of 2022, I was on a overdose fatality review. We would review individuals. We called it the SIM module, the sequential intercept module. So it basically reviews and goes over, the touching points of someone who might have overdosed within Davidson County. And, I was on there because the Davidson County Sheriff's Office, the jail, was one of the touching points. They also had, ERs, treatment centers, that was a touching point. But what I noticed while I was on there, we were reviewing a female individual who had overdosed, and that individual, the touching point was the Behavioral Care Center. And I was like, what, this can't be happening. We've got to do something. I've got to do something. So on those reviews, you might know the name of Trevor Henderson. he was on there on the review panel, and I asked Trevor, I was like, this is not acceptable. We have an active audience while we're here. We need to do something. And he put me in contact with Ropes, which is a regional overdose prevention group, the Stars Nashville group. I don't know if you're familiar with them or not, but they are a local. They're here in Nashville. And Jeremy Reese is who he put me into contact with. And Jeremy came in and he started doing classes for residents at the behavioral care center. So he would do classes on how to use a Narcan kit. And the class also include overdose prevention and what to do. And when they finished the class, they would get a certificate of completion. And then when they left the behavioral care center, they would leave with a Narcan kit. So then that was October of 2022. Then in April of 2023, so we were doing some great things there at the behavioral care center, and we felt like we were making an impact. A lot of times it's hard to measure that impact. On occasion, individuals will get rearrested and they would come back to the behavioral care center and they would say, "Hey, I really appreciate that Narcan kit. I was able to save someone's life." You heard it then, but it's very hard to measure, what kind of impact you're having.
Right.
April of 2023 came around, and my third shift supervisor, her name is Ariel Curtis, came to me and asked me, because she's got a passion for it. She's got some family history of overdose and different things like that. She asked if she could pitch an idea to the sheriff, and that idea was Narcan vending machines. She saw online somewhere where different jurisdictions across the country, communities were offering these Narcan vending machines that were free to the public to use. And her idea was, hey, why not get a couple machines here at the sheriff's office so that we can not only help the population, a larger part of our population. We house around 2,500 inmates at any given time. So we do about 120 releases a day. Why not put this in front of individuals who are getting out of jail, and not just the individuals that are getting out of jail, but the employees that work here. Overdose has touched not just the population that we have in jail, but the employees that work here,
Certainly.
and the public. So we wanted to make sure that wherever we had the machines, they were accessible to that. So she pitched this idea to the sheriff, and he was all in. He was like, he pride ourselves in being an innovative jail here in Nashville, thinking a little bit more outside the box when it comes to different things like this. So he was all for it. So we come back from that meeting, and it was like high five. Yeah, all right. I'm glad we're
Right.
we're very excited about this and everything. And then we both sat down like, well, where are we going to get the money for the machines? Like, we're like, oh, well, we got to do our homework here. We got to, well, and then I leaned back to my conversations with Trevor Henderson, right? So I reached out to Trevor and I was like, look, the sheriff is all on board. He really wants to have these machines. I was like, are there people out there that would donate money? Are there grants? Are there different things like that? And I don't know if it was just timing or the time that I called, but he said yes. Amy Morawski, the director of overdose response coordinator for the state, has money that needs to be used before September.
Okay.
So here I am hustling, getting a hold of Amy, and we landed it. She bought two machines. The state of Tennessee, it's actually the State Department of Health, basically. The Tennessee State Department of Health is who she works for.
Right.
Actually purchased the machines here for the Davidson County Sheriff's Office. And so we're so grateful for that. And then all of a sudden, we were like, okay, well, we got the machines. Well, now we need product. We're going to get this product, because I'm not sure how much you know about it, but they're not cheap.
No.
I mean, I think it's $60 a unit. For a Narcan kit itself, I think is around $60.
Yeah.
So it's fairly expensive. So, I'm so grateful to have the network that I have in Trevor, because I reached back out to Trevor again and I was like, do you happen to know any contacts out there? And he said, yes, I do. He said, you need to get a hold of Andy Hall, who works for HICMA. And that's like a pharmaceutical company who does donations. The only kicker with that was that they can't do donations to government entities.
Huh.
So we had to do a workaround for that. And that's when Jay Crossan came into the picture. And he is the director of Cumberland Heights, which is a local treatment facility here in town. So the donation goes to the Cumberland Heights, and then Cumberland Heights in turn gives us a donation. Of course, they keep 25% of the donation, and the donation in this particular case, our initial donation was 1,000 units.
Mm.
So we were off and running. So that we started in October 23. So we haven't been operational for quite a year yet. We started in October 23, and since then, we have issued 1,600 units, and each unit has 2 doses per box. So we've issued 1,600 units, and then in each one unit there are 2 doses. And though I mentioned earlier, they're 8 milligram Cloxato, so it's just more potent.
Right.
Since then, we've already gotten from Andy Hall and the Hickma group. We've already got another 1,000 units from them. So we've had over 2,000 units from them. And then I just got word from the STARS Nashville group. His name is Charles Cuthbert. He said that he had a lead with the state representative, and we have another 2,500 units, free units, coming to help fill the machine. So, bravo for the word getting out, that we have these machines.
Yeah.
And he reported too, and I have an email with data that I'd be willing to share with you and your listeners if they want to see it. It's data for overdose. So what he reported to me that overdose fatalities, overdose EMS response, and overdose ER visits are all down compared to this time last year. So I'm not saying that because of these Narcan, the things that we're doing here at the Davidson County Sheriff's Office, but we're not the only ones that are doing it.
What's so striking about this is you have a county government, specifically, the sheriff's office, working with the state government through the health department to partner with a private company in Hickma and a treatment center to implement this intervention at a really crucial window of time in the lives of people at risk of overdosing, which is that 2-week period right after they're released back into the general population. We know, their tolerance has lapsed. If they try to go back to what they used to do, that's where their risk of fatality is very high. But this, you keep them alive, you increase their likelihood they get into treatment. It's just interesting to see such an intergovernmental and private sector collaboration on this. It's a really fascinating combination.
Yeah, it's like a multidisciplinary approach, because there's a lot of different disciplines that are involved in, collaborating together for one common cause. The machines and the kits, I don't want to see anybody die. That's
right.
My goal is, to have those and to provide those, because like you said, they're most at risk a couple weeks after they get out. But since this has been operational, I've had and I failed to mention also that we are the only county jail in the state of Tennessee that has these machines.
Oh, wow.
So that was something that the Tennessee Department of Health mentioned to me. That's something we should be proud of, that we were the first. And since then, we've had counties across the state that have inquired, like, how did you go about getting these machines? How much are they? So I've been able to share that information with these other counties. And then even our local Metro Health Department, I met with back in April of last year, because they caught wind of us having the machines. And it might have been because Councilman Evans, I think you recently had on one of your podcasts, I think they had some opioid abatement money maybe that they're tapping into, and they wanted to purchase some machines for some of the Metro facilities. That's kind of where we're at right now.
That's definitely worth some follow up. And as you said, you can't draw a direct causal relationship, but I can't see how this hurt. If anything, it strikes me as a potential very strong contributor to the reduction in overdose fatalities nationwide. We've seen this, and of course, every location is a little bit different, but across the country, we're seeing reductions, and very often it's being attributed towards increased access to naloxone. So if this program is right at that crucial window, it seems to me that it could be playing that role. I also understand in terms of innovation, the Davidson County Jail also has a medications for opioid use disorder program. Is that the case?
Yes. So yeah, we do have a MAT program in the jail, being mostly used at the behavioral care center. And then, of course, we continue the care. If an individual gets arrested that is on MAT, we will the jail itself will continue MAT while they're incarcerated.
That's a big deal because there have been instances across the country where people their medications are ceased. Do you know if you have any data? I know the program's only been around for about a year, I think.
I don't have any data yet. Yeah, it's only been going on for a year, but that's a great point to be able to see if that's helping on, readmission.
In terms of launching that program, how did the conversation therein go?
Yeah, so when we put individuals when they got arrested and everything, we would track that individuals were on MAT, and we were saying, like, well, how do we continue the care from there? And because it wasn't something that was currently built into the contract, so there was something that we had to do a supplement to the WellPath contract because it's a contract service that's through the Metro Health Department. The Metro Health Department oversees WellPath, who's our medical provider. But we built that back into it, and then as we started going, we were like, well, I think we want to pilot this. Let's pilot trying to set people up with MAT. We do a needs assessment on individuals that come over, and part of that needs assessment is pitching or asking individuals if they want to start it.
Mm.
One of the barriers that we have on individuals continuing the care is the price of it when they get out. The cost of going to the clinic and the cost there. So I've been busy trying to, try to find grants and different things like that could help supplement the cost of that. It's just the same problem we have here in Nashville and Davidson County and across the country and other counties is housing. We have the same problem when we're trying to find affordable housing for individuals when they get out as well. The MAT is no different. So that to me is a barrier getting individuals signed up because yes, it's free while you're incarcerated, but the longest you're going to be in our local jail is 11 months 29 days.
Mm.
So you only have so much time, and then at the behavioral care center, the max stay at the behavioral care center is 30 days. So we can get you started on the MAT, but it would be up to the individual when they get out to find funding, I guess, to continue that care. So that's definitely a barrier.
It's an interesting situation because normally there is, for some individuals anyway, easier access to medications for medically assisted treatment within a jail and not within their community. That they're having trouble finding, 3 hots and a cot and their medication to prevent relapse outside in the community, but in the jail they're getting pretty good care. That's a reverse of a situation we've seen in other areas.
Yeah, they're offered a lot. Like I mentioned earlier, there's a lot of programming that's offered, for free, obviously here, at the jails as well. Some amazing programming, New Avenues, which is a drug and alcohol program that we have here for the males, and then we have Healing Journeys that we have a drug and alcohol program for the females. So those types of things are, case management talks to the individuals about different types of programming that we have here in jail. And, we also have GED or HiSET to continue their education while they're here too. So the goal is to give them as much information as we can while they're here. We really want to connect the individuals with the community when they get out of jail, because we feel like that has helped readmission, connecting them with the community. If that's, your local churches, if that's treatment facilities. If we have a group called Transitions to Jails to Communities, it's a quarterly meeting that we have that Dr. Turks organizes here at the Sheriff's Office. It's in a quarterly meeting where we invite our community partners to come and have breakfast and talk about their agencies and what their agencies can do for individuals who are incarcerated. And we feel like having that connection or making that connection with the community is important to us, so that we can try to help individuals the best we can. Making that connection before they get out of jail too is important.
Right.
Having that community provider come into the jail and so that the individual can put a face to the name. So like if they're going to the dismiss house, which is local here, and they have a dismiss house counselor that comes in and can talk to the individual, so they feel more comfortable actually reporting to the dismiss house when they get out. And that's just one group here in Nashville that we work with, housing, and then they have They also come in and do a IAP program, which is pretty unique. Individuals, they come in and do a class about like, what's your dream job? Not everybody wants to work in construction and food service, right? My dream job might be an underwater welder.
Right.
Well, the IAP program with Dismiss House is going to point you in the right direction, get you the right path to be an underwater welder. So it's unique, but that's just one program that comes and provides services here.
The things you're describing, we recently had on Sam Canones on, the author of Dreamland and The Least of Us, and he described a need for us to rethink law enforcement, but in a reverse direction of what we've been hearing, is that we don't need to be averted in some situations to putting individuals through the carceral system, provided that they are getting access to recovery services, to treatment, to educational opportunities, that they are connected with warm handoffs to community organizations. He says that system, though we don't do very much, he says, where it is happening, it's having some impactful success. We've also talked with Sergeant Mike Hotz in Nashville of the Metro Nashville Police Department. He leads their overdose response unit. There is a similar, all hands on deck, all tools in the toolbox approach, and it does seem that there's some good results happening in the numbers in Nashville anyway.
Yeah, that's good. That's good to hear. I'm glad that that's going on. Yeah, you mentioned the warm handoff, but the behavioral care center, that's what they have, is a soft or a warm handoff, that no one gets released from the behavioral care center to the streets. They actually get released to someone. That someone might be a family member, might be a friend, but it also, most of the time, it's a treatment facility that comes and picks the individual up. So I think you mentioned it, but it's important to have that connection within the community for sure.
Might I ask, what are some things that need to be kept in mind if you are running say a rural county jail and you're interested in either a naloxone vending machine or an MAT program? What are some important things to keep in mind?
The barrier is a big deal to me with Matt. I mean, the barrier of the funding and trying to get either grant funding or different things like that to try to subsidize, to try to get the individual to where they're, having a minimal payment to continue to stay on the MAT program. I would think it would be pretty easy to start it up, if you had a local Metro Health Department, or if you're contracted through another entity to set up MAT. There wouldn't be any barriers there to get that done. I think that would be something that could be accomplished. The Narcan, if any of the listeners that are listening need information, I'm sure you can give them my contact information, and they can reach out to me, and I'm very open book as far as where we got the machines, details on like how we got the funding, because I think, again, the machines themselves are about $5,000 a piece.
Right.
So they're not cheap, but we got lucky in that we were able to get grant funding that was running out through the state of Tennessee. We were able to get the funding through them, but it's out there, this company that we got the machines from, that's what they did. They made Narcan vending machines. So it's not like your local vending machine company that you're trying to make the machine fit what the machines themselves. If I had pictures with me right now, they have information and signs all around them. We also have a QR code on them and get more information about overdose prevention and different things like that. So I think that it's something that I hope gets traction, across the country. You mentioned it earlier. First couple weeks after incarceration, individuals who do use, before they go into being arrested or being incarcerated, their tolerance level might be at a certain level, and then they get out and they try to use the same amount or have in contact with some bad drugs. Having that Narcan can save a life. I don't feel like we're promoting using drugs. I'm promoting saving lives.
Right.
With the machines, and that's our ultimate goal. And I'm hoping that agencies across the country, not just sheriff's office, but something like our Metro Health Department is doing, the community, and getting that more mainstream. I think moving forward, I hope that this gets traction and jails across the country follow suit.
I've been curious about the connection to mental health because you mentioned that there's a lot of the Behavioral Care Center, the BCC, has been seeing a lot of this, and that's where the MAT is accessed within the jail and so on. Just wondering if we could get your thoughts on the connection to mental health with this crisis.
What we have found out of individuals, they have a lot of different co-occurring disorders going on. They not only have a mental health disorder, but they have a substance use disorder. And then sometimes what they'll find out is that individuals with substance use disorders have been self-medicating with drugs and alcohol to help their mental health disorder. You know, they get over there, they've never had individual treatment, individual therapy. They've never had group therapy. They've never seen a psychiatrist. So the jail is about a 75% readmission rate for those who have a mental health diagnosis. Those individuals that come to the behavioral care center and leave, we're right now at about a 39% readmission rate.
Wow.
So it's considerably lower than the jail side. And a lot of our number, that 39% might seem high, but we don't shut the door on an individual because, you know, it might take them 2 or 3 times to get themselves back on track or get themselves on track. So just because you came through the behavioral care center one time doesn't mean that we'll not accept you the next time you come in or the next time.
Especially if there weren't, so sorry, if there weren't any connections to outside options, treatment options, if they went out and came back in, et cetera.
Yep, correct. So being arrested is a mental health crisis on its own. You know what I mean? Like being arrested is traumatic for any individual. So, you know, I got to see that, you know, that especially if an individual was their first arrest and different things like that, you see the emotions and the trauma that is created when someone just gets arrested alone. We've been open for 4 years now at the Behavioral Care Center, and I can count on one hand how many incidences we've had where we've actually physically had to put our hands on somebody. We would rather de-escalate a situation and talk to a person for an hour than to physically put our hands on them. So the individual might be in a mental health crisis or whatnot. You know, and that doesn't mean that the behavioral care center works for everybody. You know, that there are individuals that are there that get placed on behavior plans because their behavior needs to be corrected while they're there. And the unique thing about the behavior plan is it's the resident, the technician, and a mental health provider that's there that goes over a behavior plan with the person. There's things that are happening within the facility that need to be corrected. And here's your plan, your behavior plan on correcting these. If you can't correct them, you could find your way back to the jail side. So I bring that up because sometimes people ask, you know, like, well, are they all successful? And it's a small percentage, but no, not everybody's successful that goes through. Sometimes they'll have to go back to the jail side. So our readmission rate might be a little higher because the first time they come through, they might not want to go to treatment. The second time they go through, they might not want to go to treatment, but that third time, they're like, man, I think I really need to go to treatment. And that's when the light bulb goes off and different things like that. And we have so many success stories. It's pretty unbelievable. We have individuals that show up to our lobby at the behavioral care center. And I don't know where across the country you have individuals that, you know, come back to jail and say, hey, thank you for what you've done. But we have countless individuals who come to our lobby at the behavioral care center to say thank you. The sheriff was the one that had the vision, right? So instead of building a 5th floor of housing on the new downtown detention center that I was on the transition team over, he decided he was going to build a behavioral care center because during that time, while I was on the transition team, he was the American Correctional Association president and the National Sheriff's Association president. And what he heard from sheriffs from across the country was that the mental health crisis of jails, that jails have become your mental health facilities. And how do we manage it? How do we help individuals that come into contact with the justice system? What can we do? And that's when he was the brainchild, I guess, if you want to call it, of the behavioral care center. And when he mentioned that I was going to be that guy, I was elated. We traveled to a couple different places in Florida, looking at some mental health facilities, and I'll tell you this: there's no blueprint and there's no book written for what we did or what we're
Mm.
doing here at Behavioral Care Center.
What would you like to see in terms of potentially a law or a policy to make things like naloxone vending machines, medication assisted treatment in jails, behavioral health in jail, et cetera, maybe, and then reentry connections as well, some of the topics you've brought up. Are there any policies you'd like to see to make any of that easier?
Wow, yeah, that yeah, that would be amazing if we could create, have some policies on a lot of the hot topics that are out there that are affecting the communities across the country. You mentioned, access to, naloxone is obviously important, but I think, across the country, I think they're making strides in that. You mentioned the numbers going down, but trying to have a policy for that and being able to provide units and making those units more accessible and maybe having a policy or funding, different things like that for machines, for county jails, for across the country, for those counties that want to make an impact. And man, the MAT program, and I mentioned it's a really big barrier for individuals to have funding. And I don't know if, the I know that there's opioid abatement money, and I don't know who's the powers to be that are over that funding, but it would be really great to not just myself, but other organizations who have MAT within the jails to partner with them to try to appropriate some of those monies to help individuals when they get out of jail. Maybe having a policy on those who do become incarcerated, that maybe that funding would be available for individuals to continue that, because I think it's tremendous help to individuals, the MAT program itself, and trying to get themselves back on track. So
Okay, thank you. Do you have any final thoughts for me?
no, I just appreciate you having me on here. This has been, Jeremy, this is my first experience on a podcast. I've had these conversations numerous times in meetings, on tours and different things like that. But, being able to have my voice out there that people, might want to listen in and, grab something from it. And like I said, if there's any of your listeners want to reach out to me, have any questions, have any more questions, feel free to give them my email. I'm very responsive, so I'll definitely reach back out to them. I appreciate you having me on here.
Thank you, Eric, very much. The pleasure's mine. For more episodes on in-depth discussions on Tennessee policies related to substance use disorder by a range of local experts, please subscribe to us wherever you get podcasts and visit our website at smart.tennessee.edu. I'm Jeremy Corvelis. Thank you for listening, and see you next month.